Good morning, and I'd like to thank Betsy and the Iowa Local section for inviting me to talk today. I'm going to talk about some public health implications of climate change. And I know I promised to stay associated with the state of Iowa, but I'm going to talk about some natural disasters in terms of national impact and also national public health impacts as well. So I'm going to skip ahead a little bit for a few slides, mainly in the interest of time, but talking a little bit about what is climate change and some evidence. I'm specifically going to talk about the health impacts and the public health role, and then also some natural disasters that have happened not only in the state of Iowa, but nationally and also generally in the Midwest. So probably seen photos like this before, talking about greenhouse gases, and as Dr. Stanier talked about, piling the blankets on the earth. 6 major greenhouse gases: water, carbon dioxide, methane, etc. Probably seen this graph before associated with increase in mean temperature. Another graph that shows not only sort of the variation, but also the linear increase in temperature as well. Decrease in the Arctic ice caps. And also here's some pictures of a glacier in Nepal. And sort of a personal aspect of this, my husband and I, we took a trip to Alaska in 2006 and went to see Mendenhall Glacier. And he had taken a similar trip in 1988. And it's very interesting to see the photos from 1988 to 2006 as far as the decrease of the Mendenhall Glacier in Alaska. So, potential impacts of climate change. Everything is impacted by climate change, not only health, agriculture, the environment, water resources. And when we talk about all of these different aspects, all of it really goes back to public health. We're in a crisis in public health nationally. Funding keeps getting cut. Every year it's interesting to see how much money the State Hygienic Lab is going to get, particularly in emergency preparedness. And that's sort of why I took the role in terms of talking about natural disasters and disasters in the state of Iowa, since that's my area of expertise. But it's very interesting when we talk about public health nationally, because as funding gets cut, not only does climate change affect public health, but we don't have the funds to sustain that system anymore. So, what are some climate impacts on public health? Well, extreme weather events, heat waves can also fall into that category. We're going to talk pretty significantly about that. Dr. Gracian had talked about particulate matter, talking about air pollution, reduced air quality. I'll talk a little bit about some climate-sensitive diseases, and then other health impacts, as Dr. Hatfield had talked about in terms of Iowa and agriculture. This is an interesting slide. This is looking at some extreme weather events in 2011. Every state was impacted. According to the EPA and also to NOAA, when we talk about extreme weather events, there were actually 14 major ones in the year 2011. Financial impact from that was $53 billion. That's not including, when we're talking about medical care, things like that. It's all over the map. We have everything from extreme rainfall to extreme drought, flooding, extreme temperatures. And one thing this really doesn't show is tornadoes, and we'll talk about the Joplin tornado in 2011. But really in 2011, of course, we talk about Hurricane Irene, definitely had a major impact nationally. Looks like the West Coast might have been a good place to live at this time, because it doesn't seem to have as many dots, for lack of a better word. But look at Texas. Texas had everything from extreme temperatures to extreme drought to extreme rainfall. So Texas got hit really hard, and in general, the Southwest did as well. So when we think of natural disasters and extreme weather events, we have to take care of our people. If we look at things like hurricanes, for example, for Hurricane Sandy, people have to be evacuated. And there's a lot of things that goes into that. Emergency plans are wonderful, but planning is just one aspect of this. Nothing ever goes according to plan in emergency preparedness. We may have hundreds of pages of emergency plans, but when it comes right down to it, really you have to be able to think on the fly. And when we're talking about an extreme weather event, a natural disaster, we have a lot of things to deal with. First of all, reduction in the availability of fresh food and water. How do you feed people? How do you get potable water to them? We also have interruption of communication, utility, and healthcare services. The Joplin tornado destroyed St. John's Regional Medical Center, and I've had numerous conversations with the emergency preparedness coordinator at UIHC. What would happen in an EF5 tornado took out the University of Iowa hospitals and clinics? They get the sickest patients in the state of Iowa. And Mercy Medical Center is not too far down the road. So when we think about natural disasters, healthcare is a big aspect of that. You can also have increase in stomach and intestinal illnesses. Sometimes when we talk about regulations associated with public health, sometimes they seem pretty burdensome, but you have to keep people healthy. Can you imagine someone in an extreme heat wave getting some type of intestinal bug, and then you have disruption in healthcare services? They can get dehydrated and sick very, very quickly. And one thing people also, maybe we don't think about as much as the mental health impacts, such as depression, post-traumatic stress disorder. We put people in shelters, and the mental health aspect is something we may not address. Sometimes people won't evacuate because of their pets. What do you do with pets? You have a separate shelter for them. Some shelters allow the pets to stay in a different area. But when we're talking about natural disasters, the human factor is so important. Not only do we have to keep people safe, but it's a good idea to keep them, healthy as well. So there's a lot of different aspects that go into setting up a shelter. Most people say, oh, just call the Red Cross, they know what to do. Yes, they do, but there's a lot of different aspects associated with that. Here's a graph looking at the United States recent past from 1961 to 1979 and looking at the number of days over 100 degrees. Looking at a low emissions scenario for projections and then a higher emissions scenario. So when we talk about heat waves, very important to look at the health impacts. So not only do we have to deal with heat stroke, again, if you have a natural disaster, there may be a time where your health services are interrupted. So heat stroke, dehydration, cardiovascular failure, heart attacks, etc. But you also have an increase in air pollution, which can then cause respiratory illness, asthma, etc. Dr. Grassian talked quite a bit about air pollution. When I used to work for Linn County Public Health, I worked in the air quality division, specifically monitoring air toxics, but we did some of the regulatory pollutants as well. Some aspects of air pollution, of course, is increase in the ground level ozone or photochemical smog, changes in particulate matter. And this can result in a lot of different things. Respiratory problems, as mentioned, such as asthma, also an increase in allergens. So not only do we have some of the more severe illnesses, such as asthma, there's been a significant increase in childhood asthma just in the last 25 years nationwide. I remember when I used to work at Linn County, and the Gazette did a very, very nice article about our air monitoring program. And it was really neat to see some of our staff members on the front page of the Gazette, and not only just doing the regular air monitoring, but they also talked a little bit about the pollen counting as well. And I remember reading some of the comments online. Some of them were pretty cruel, talking about big government and why do we need to monitor the air. And someone wrote in and said, my daughter has asthma. And these numbers mean something to me every day that they post. And I think that's one of the reasons we do work in public health. We want to protect the health of the public. So, you know, even if just a few people benefit from putting those numbers out there every day, that's worth it. Climate-sensitive diseases. I'll talk a little bit about some of our work at the Hygienic lab with this, but we can see potential impact looking at not only foodborne, but waterborne and animal-borne diseases. Foodborne diseases such as salmonella, these bacteria can certainly thrive in warmer climates. One of the things that impacted the state of Iowa this last summer was the cyclospora outbreak. And maybe some of you don't know much about cyclospora. It's a parasite. We had over 150 cases in the state of Iowa. Cost the state of Iowa several $100,000 to deal with it. And one thing you may not know, cyclospora, it's a parasite. Not many laboratories in the state of Iowa test for it. So we were inundated with specimens. We tested over 4,600 specimens. And a lot of times we get the comment, well, okay, someone has a disease and it goes to the hygienic lab for testing, some type of specimen. Doesn't the doctor just treat it and then get the result later? Not with cyclospora. They would not treat with a specific antibiotic till they got a positive result from us. So we actually had to send some specimens out to other state public health laboratories. A lot of laboratories have cut back on their parasitology testing due to budget. In fact, the VA hospital laboratory, which actually helped us out during the outbreak, they were actually going to be doing away with parasitology testing, but because of the veterans coming back from the Middle East, they decided not to. So it was a blessing in disguise that they were, that they had cut that out of their program. So we have foodborne diseases. Cyclospora affected about 600 people nationwide. Most of the cases were in Iowa and Nebraska, but then Texas had surpassed us with that. Some of the symptoms of cyclospora can be basically watery diarrhea for almost 2 months. Talk about having that in the middle of the summer. You're going to be pretty miserable. Waterborne diseases, talking about cryptosporidium, giardia, and also animal-borne diseases. My little mosquito there with malaria, talking about dengue fever, also looking at Lyme disease with ticks, West Nile virus. So we can see a certain increase in some of these, what we used to consider almost tropical type diseases. Here's an article from the Iowa City Press Citizen in 2008. It says disease, water temperature, water temps linked, and talking a little bit about waterborne illnesses. And then also another article in terms of the Des Moines Register, looking at some of the possible consequences for the state of Iowa, including weather, health, emissions, agriculture, and also wildlife. All right, so this is getting into my area, talking about natural disasters, emergency preparedness. So 2008, we're talking about the Parkersburg tornado in May. 7 people in Parkersburg were killed. 2 people were killed from New Hartford for a death toll of 9 people. Interesting, when you look at the Parkersburg tornado, this was an EF5, strongest tornado. And one thing that was very interesting about the Parkersburg tornado is a little bit of background in emergency preparedness. The National Wildfire firefighters have used a system called Incident Command for many, many years in order to manage some type of an incident. You usually have your incident commander, you have the people that support them in different branches such as logistics, et cetera. And it's very well established with firefighters who basically battle wildfires. This was the first time in the state of Iowa that Incident Command was set up for any type of disaster. And I was talking to the Greene County Fire Chief at that time. And When we think of disasters, we think, oh, FEMA's going to reimburse us. That's always the, the standard thing. Oh, FEMA will be here. The feds are going to be here. They'll help. Well, because of his due diligence as far as incident command, getting people to sign in, they actually got several $1 million reimbursement from FEMA to help deal with this disaster. And if he hadn't, I don't know actually what would have happened, but a very, very devastating EF5 tornado. I promised I'd talk a little bit about Joplin tornado too. 2011, Joplin, I think it was May 22nd, I believe, Joplin was hit with an EF5 tornado. St. John's Regional Medical Center was completely destroyed and took a direct hit. The entire time of this tornado was 38 minutes. 158 people died in 38 minutes. However, that's a lot of people. However, at the last minute, the principal had decided to move the graduation ceremony from the school to another location. It could have been devastating. Thousands of people could have been killed because the school took a direct hit, roof came off of the school, and it's very, very sad to even think about the consequences of that tornado. EF5 tornado in Joplin, and one in Iowa in Parkersburg. Joplin was also interesting too. Joplin didn't have a lot of federal help. The state really managed most of the incident with that, but 158 people killed, just 38 minutes. It's amazing how much your life can change so quickly. Don't know if this even really needs much explanation. 2008 flood in Iowa. Billions of dollars. We still haven't recovered. It's nice to see the cranes here at the university, seeing Hampshire rebuilt. We think, oh, 2008, that's not that long ago, 6 years. Cedar Rapids still hasn't completely recovered yet. So, I mean, talk about devastating aspects. I was not working at the Hygienic lab at this time, but looking at the testing that the Hygienic lab did in terms of the water samples is just phenomenal, and even the cost at that time. The 2008 flood not only impacted private citizens in terms of homes, 5,000 homes destroyed or affected in some way, it also affected our university, the University of Iowa. So what can we expect with Iowa climate change? Milder winters. Probably disagree with me on that one from this last winter. It seemed like everybody wanted to escape and go to warmer climates, but hotter summers. I remember a couple summers ago we had extreme heat wave. It was pretty miserable. One thing with emergency preparedness, I think that's very frustrating for some of us in the game. There's times when we have to deal with drought, and we run our drought plans, and then when you know it, Mother Nature sends us a flood. And sometimes it's vice versa. Last year, we were already working on our drought plans. We had flash flooding in the spring last year. I remember several times I got called out to the Emergency Operations Center to deal with that. So it's not like, oh, one summer we're just going to have drought. We can have flooding and drought in the same year. Flooding predictions were pretty mild this spring, which is good. But what's kind of interesting, I think, about Iowa is they're also predicting now pretty extreme tornado season this year too. So not only do we have to think about how this impacts our citizens, but when we look at national policy as well, natural disasters cost the United States lots of money, and FEMA's getting their budget cut as well, so we just don't have the support that we need at times. And Dr. Mike Wickman, our associate director, shared this slide with me, this cartoon, and This is sometimes when I think about people who are not on board with climate change or are somewhat indifferent, but I just like this. What if it's a big hoax and we create a better world for nothing? So we have energy independence and green jobs, livable cities, clean water, air, healthy children, etc. So I will close with that. Thank you.